All right, so when we're assessing the pupils, there are a couple things to keep in mind. What we're looking for is we want to look at the size of the pupils. Are they equal? And do they react? How do we check the reaction? Well, in this case, we've got plenty of light around us, so you should be able to just simply cover it, wait a second, and lift it up. Cover it, lift it up. When you cover it, it should get bigger, and when you lift it up, when the light hits it, it should shrink back down. So I'll do this side. That's one way to do it. Now I'm going to pull out the pupil gauge, just kind of give you an idea as to where we're at here. She's about midway through, so if you look, she's about a 5. Okay. The extremes of this are, that's if it's super dark outside, and if it's super light. If you're on one of the extremes and they don't react, then that's definitely an indication of a couple of different things, usually some type of drugs that are involved. Could be a head injury, whatever. So again, you can cover and look, or you can use a light. I always encourage you to use like a pen light, something that's really made for this, because you really don't want to put super bright light in their eyes. In that case, you can see them respond pretty good. See them get smaller, so I'll use the gauge here, and you see it goes from where she's at right now, which is about a 5, to about a 3. 5, about a 3. We're going to do the same thing over here, just to give you perspective. Now, if you don't have a small pen light, the only thing you have is like your light that you use at night, you try to avoid hitting them directly in the eyes with it. So you just bring the edge. That's all you've got to do, just enough to get the eyes to react. And again, you're looking to see that the pupils are equal, that they both react. If you find one that doesn't react, it's not a dumb question to ask if they've got a glass eye, because that would obviously indicate, would be the reason why the pupil's not reacting. But again, making sure those pupils react equally. She's got good color difference between her iris and the pupil, so it's real easy to see on her. Some people with darker eyes, I've seen it most commonly in people with dark skin. African Americans will have a real dark iris, and the pupil is really hard to see inside the iris and see the reaction of it. So those generally I have to use a pen light to be able to see. Even with quite a bit of light in the back of the ambulance, it's still really hard to see. So to get a good assessment of people with really dark eyes and then see their pupils, a lot of times you'll have to use a pen light or some type of light outside of just the ambient light. But that's checking pupillary response.